Next question, the member for York South West.
Thank you, Mr. Speaker. As case counts skyrocketed in communities across the province, the need for quick and accurate testing is more important than ever. Unfortunately for the people of Ontario, the minister has chosen not to deploy their rapid testers, instead choosing to sit on them for months. Communities like mine in York South Western are desperate for resources like these. Mr. Speaker, can the minister tell me how many rapid testers the province has in its possession now, and why they have not been deployed?
Minister of Health.
Well, I thank the member very much for the question. You're absolutely right. The rapid tests are, as the Premier said, a game changer because they're needed in so many different communities and in places like the long-term care homes, in some of the more remote communities in Ontario, and in many other locations. But I can advise that we have received 98,000 of the Abbott ID Now tests. We have 1.2 million of the Pan Bio tests, and they have been deployed to a number of hospitals and long-term care homes and other areas of congregate living. They are being deployed now and will be used within the next few days, and I will be having more to say about that at 1 p.m. this afternoon.
The supplementary question.
Back again, Mr. Speaker. It is not acceptable to sit of these testers while people get sick, while communities like mine face devastation. Families, workers, and all Ontarians deserve better. So I ask again, Mr. Speaker, why has the government spent one long month sitting on these rapid testers, not using them to identify cases and keep people safe?
Of Health.
Thank you very much, Speaker. And I would say to the member opposite, through you, Mr. Speaker, is that we have not been sitting on the cases. We have been actively moving them and deploying them to the places where they are needed the most. We know that we are dealing with situations where people want to visit relatives in long-term care homes, that the staff need to be tested. The Minister of Long-Term Care has indicated that in areas of the high-risk zones, people are going to be tested weekly. These rapid tests are going to be greatly helpful for that, as well as for the people that are going to be visiting the homes. We also need them in our hospitals. That's where they're being deployed right now. And as soon as we receive more supplies through the federal government, we will be sending them to more hospitals and more long-term care homes. The need is urgent. We recognize that, and we are moving these tests very quickly.